Here, I see Representative Crawford is not here on time today, so let the record reflect that. I'll pay for that comment later, but that's all right. We'd like to welcome our House pages. Fisher Brinson, if you'd stand up. Jace Eisler and Abby Cray. Thank you very much. We hope you learned something here today, but if you don't, it's good to have you here anyhow. We have the Sergeant at Arms today, our renowned Terry McGraw, Nina Lage, Bill Riley, and Stafford Young. Thank you very much. We have 4 bills today that we'll move through. The first one is by Representative Cunningham, Loftus, Lambeth, and Potts. Chair recognizes Representative Cunningham for House Bill 328. You held her in as long as you could, Representative Humphrey. I appreciate that.
Good morning, committee. Thank you, Mr. Chair. First, I would like to thank my primary sponsors, Representative Loftus, Lambeth, and Potts. This is really a simple bill. What it does, it bans Delta 8 and Delta 9 products from being in possession, use, and distribution.
Excuse me, Representative Cunningham. This is a PCS. It was sent out without objection. Thank you, Representative Shepherd. Is there a motion to accept the PCS? Representative Clambath, all in favor? Aye. Aye. Any opposed? Thank you, Representative Cunningham.
Thank you, Mr. Chair. So it prohibits the products on all school grounds. These products, which include various forms of cannabis, have gained popularity in recent years, particularly Delta 8, the THC, due to its legal status in some regions. Despite being considered less potent than Delta 9, both substances can still have negative effects, particularly for minors, and pose potential health risks like impaired cognitive function and judgment. To clarify the ban on the vapor products, it further clarifies that all vapor products, including e-cigarettes and other vaping devices, are banned on school grounds. It aims to close any legal loopholes that might also use the vaping products, ensuring that students are not exposed to these potentially harmful substances. So I'm just going to share a little bit of information of what's been going on within the state in regards to it. In Leesville Road High School here in Raleigh, fire alarms are frequently triggered by students vaping in restrooms, which has led to the closing of half of its bathrooms or restrooms, implementing stricter discipline measures, including potential long-term suspensions. Cumberland County has implemented a national vaping and nicotine prevention program in each of its middle and high schools to try to curb the rates of youth vaping. And in my own county, Mecklenburg County, reported over 758 documented incidents of vaping devices use last school year, and students saying they vape in bathrooms and locker rooms. There are numerous discipline actions that are being implemented across the entire state by different school board districts. What we're trying to do here is to put something in place that will be unified, that all school boards and school districts will have available to them as a tool. Thank you, Mr. Chair. I am finished.
Thank you. Questions? You got a motion, Mr. Representative Lamont?
I had a question first,
please. Yes, sir. You're recognized.
Thank you. Representative Cunningham, does this ban going to apply also to all the adults, bus drivers, teachers, and anyone else that's in adult capacity on these school grounds?
Yes.
You're recognized.
Thank you, Mr. Chair. Yes, it would apply to any of those individuals on the school grounds at the time, as well as at events that are taking place on school properties.
Motion at appropriate time.
Thank you. Representative Blackwell, good to see you back, sir.
Thank you, Mr. Chairman. I love being seen by you, especially.
Great day.
Yeah. I have no problem with the intent under this bill, and I'm going to vote for it, but I'm curious about something. it seems to me that the legislation, Representative Cunningham, says that all public school units are to adopt a policy prohibiting this and requiring and posting signs. Why do they all need a policy? Why don't we just say thou shalt not, and it's state law which they have to comply with? Why do we need 115 different policies?
You recognize, Representative.
Thank you, Mr. Chair. Could I yield to staff on that?
Yes, sir. Yes, ma'am.
Thank you, Mr. Chair. Jessica Bodie, Legislative Analysis. Representative Blackwell, it's a policy decision to, incorporate hemp products into the existing tobacco framework. So I would assume that, well, I can't speak to the sponsor's intent, but the way that this is drafted, it would just incorporate these prohibitions on vape products into the existing tobacco law.
Well, again, yeah, I just to comment, as the bill moves forward to rules or wherever, I wonder if the sponsors might want to at least think about the idea of just saying, hey, you're not going to do it. That's the state policy. And, but anyway, I'll leave that to the sponsors to decide. Thank you, sir.
Thank you, Representative Blackwell. Any other comments? If not, the chair will entertain a motion. Representative Rampant.
Motion to approve PCFs for House Bill 328, favorable, unfavorable to the original.
With a referral to education, K-12.
Yes, sir, what you said.
Any further discussion? Hearing none, all in favor, aye. All opposed, likewise. That bill passed, Representative Cunningham. Are you ready to do 329?
Yes, Mr. Chair.
I believe we have an amendment on there, which I'll offer. It's a motion to amend lines 1 and 2 and 4 and 5 to read tobacco and hemp products and tobacco products and hemp-derived consumable products. It's a technical amendment that the staff thought we need to put in there. Is there a motion for the amendment? Representative Pirtle, second. All in favor, aye. Any opposed? Representative Cunningham, you're recognized.
Thank you, Mr. Chair. Likewise, I'd like to thank my primary sponsors, the same ones on the last bill. This simply encourages the religious schools and schools that do not fall up under the public realm to also adopt some things in place to protect the students while they're on their campuses, supposedly to be learning and doing school activities. So this would put in place to encourage them to also put something in place for Delta 8, Delta 9, and cannabis products.
Questions? Seeing none, is there a motion? Representative Perret.
Mr. Chairman, I moved to approve House Bill 329 with the referral to the next committee.
Okay, we have a motion for a favorable report on 329 as amended, unfavorable to the original, rolled in a PCS with a referral to education. I believe that was it, Representative Perret.
It sounded very perfect.
All right, thank you. Any further discussion? Hearing none, all in favor, aye. Any opposed, no. Thank you, Representative Cunningham.
Thank you, Mr. Chair.
This time, the chair will recognize Representative Honeycutt. For a presentation of 349, and there is a PCS. Without objection, the PCS is before the committee. It's before the committee. Representative Honeycutt, you're recognized.
Appreciate you, Mr. Chairman and members of the committee. The PCS just made technical and conforming changes to the original edition. House Bill 349 passed the House last year 115-1. We just ran out of time in the Senate, and it just makes updates to the living will as far as it pertains to the notary, and I would appreciate your support.
Questions? Representative Sabania. Time's up, sorry.
Can you just give me a little?
Yes, ma'am. You're recognized.
Thank you, Chair. I'd like to ask a question of the bill sponsor.
Ask away.
I just wanted to ask, advanced health directives and health power of attorneys are so important, right? So I just wanted to understand why is there a oh my goodness, I can't speak this morning. Why is there an effort to remove the notary? I mean, in lots of ways, it should be a lawyer, but I wanted to understand why 2 qualified witnesses are sufficient enough to do such important documents.
Would you like to do that, or would you like the staff to do it?
Mr. Chairman, I'd like staff to answer.
Ms. Griffith, your record.
Thank you. Debbie Griffiths, Legislative Analysis Division. I would say that it's a policy standpoint, but, and there are similar situations with wills where the wills an actual will doesn't have to be notarized. For the holographic wills, doesn't even require witnesses in some occasions. And I can imagine there's situations perhaps where a person finds themselves in a hospital without these documents in place, and perhaps it's difficult to get a notary and 2 witnesses that aren't related to the patient, aren't employees of the healthcare facility, and so it can make it impossible for the document to be executed under emergency type situations.
Very good, thank you. Yeah, and that was sufficient. That's what I was thinking. Thank you so much.
Representative Clampett, you're recognized. Yeah, you don't want to speak. I had your name down here.
I'm glad you have my name, sir. We're on.
Don't feel required to speak.
No pressure, no pressure. I can handle it. Approval for House Bill 349, committee substitute, unfavorable.
Representative Ball had her hand
and
up.
referral to.
Representative Ball had her hand up first, so we'll recognize her for her comments.
Thank you, Chairman Potts. I just wanted to raise a point that actually an attorney who handles these kinds of things, I asked him to look at it, and he said that it could be dangerous in that the person who is sick might have a relative who is a notary and also stands to gain from his illness, sickness, and so forth. I don't know if there's a way to slightly change the bill to take care of that, because this would provide for an opportunity for that to happen.
I think I'm not a lawyer. We got the staff, but if you're going to be a direct benefit to it, I may have some reservations where you could notarize it or not. But I'm not asking for an answer because I don't want to put you on the spot, but if you have one.
Debbie Griffiths, Legislative Analysis. I'm happy to double check the notary requirements, but the witnesses can't have a financial stake in being a witness to the document, whether they're with the healthcare facility or whether they're a relative that would inherit under the will or intestate succession. And so I'm happy to verify that would apply to a notary too, but it's already in place in the document for the witnesses not to be in that capacity.
Thank you.
Thank you. Any other questions? If not, we have Representative Cunningham. You going to pass?
Motion at the appropriate time.
Okay. I'll let you do this one since Representative Clampett has been busy already this morning. You're recognized.
Thank you, Mr. Chair. I recommend a favorable report to House Bill 349, and it has to go through Judiciary 2 with favorable rules, calendar, and operation of the House. Thank you.
Thank you for the motion for a favorable report to the PCS, unfavorable to the original with a referral to rules. Without further questions, Judiciary 2, I'm sorry. Thank you. All in favor of the motion, aye. Any opposed? Motion's passed. Thank you, Representative Honeycutt.
Thank you, Mr. Chairman and members.
This time we'll have Chairman Lambeth up to present House Bill 397.
Thank you, Chairman Potts and committee. This is a pretty straightforward bill. It's brought to me from those who deal with these in our schools routinely. In August of 24, the U.S. Food and Drug Administration approved epinephrine nasal spray to treat allergic reactions in adults and children who weigh at least 66 pounds. The law currently allows for epinephrine auto-injector, commonly known as EpiPen, to be used and stored by public school units. What this bill does is it changed the definition of auto-injector to epinephrine delivery system. And that would include both auto-injectors and nasal sprays. It would allow public school units to use and store epinephrine delivery systems. The bill would also make technical and conforming changes to current law. So it's pretty straightforward. And as I said, it was brought to me by those who deal with this in our schools. I'm more than happy to try to answer any questions.
Representative Cotham, I believe you requested to speak.
Thank you, Mr. Chairman. I was going to offer a motion at the appropriate time.
Okay, thank you. Representative Gillespie, do you have anything to share with the group today? I just thought I'd check and see. I wasn't going to say that, but Representative Pirtle and Miller encouraged me to, so, and I succumbed to their pressure.
Mr. Chair, that's absolutely no surprise to me. Thank you.
Thank you. Before we disintegrate into not having a meeting at all, we have a motion before us. Any further discussion? Hearing none, all in favor, aye. Any opposed? Motion is carried. We're adjourned. Enjoy your afternoon.